Hi viewers, welcome. This is your host Dr. Roslyn Odhiambo on Skills versus the Midwife, and today we would like to learn on pelvic assessment during labor. Now for pelvic assessment, it will be able to confirm if the pelvis is adequate or not. Assess for the pelvic inlet. Is the pelvic inlet adequate? So what we need to do is that when we are doing a vaginal examination, of course you will go in with your fingers to do a vaginal examination, then try to tip the sacropromontory. Now this is the diameter that we normally call the diagonal conjugate that normally tells us or confirms whether or not the inlet is adequate or not. Now, in normal circumstances, we are not supposed to tip the sacropromontory. That confirms that the inlet is adequate. Number two is that we will be able to assess the nature of the sacrum. So how is the sacrum? Is it curved? Because that is the expectation. When you look at the normal pelvises, the one expected for childbearing, that is the gynecod pelvis, the sacrum should be curved top to down, side to side. Number three, we will spread our fingers on the sides where we have the sacrosciatic notches on both the right and the left side, and the sacrosciatic notch should be able to accommodate your two fingers on either side. And then of course we will assess the mid pelvis. So this is the mid pelvis. All right, so as you are going on, you will stretch your hand so that you can assess the mid pelvis. Normally we don't expect to simultaneously touch the side walls of the pelvis. In a gynecod pelvis, that will happen, that is okay. But in other pelvises that are not normal, like the indod pelvis, the side walls are not normal, they are not rounded, meaning they are a bit convergent. Then it means then you can be able to touch them simultaneously. Then move your fingers down, all right, to assess now the ischial spines. These are the ischial spines. They should not be pointed, they should be blunt, okay? So in a normal gynecod pelvis, the ischial spines will be blunt, right? Then we move now to assess the subpubic angle. So for the subpubic angle, you should make sure that your two fingers have fitted. Then finally, we need to assess for the pelvic outlet. So as we are getting out, as we are finishing, or as we are concluding the vaginal exam, then we need to make a fist and fit it in between the two ischial tuberosities, that is the intertuberous diameter, and all the four knuckles should be able to fit, and that is a sign that the pelvic outlet is adequate. So that is how we assess for pelvic adequacy when a mother is in labor. And remember the 7 assessment points that we have talked about: the pelvic inlet, that is the diagonal conjugate. You should not be able to tip the sacropromontory, and then the sacrum should be curved. Number 3, the sacrosciatic notches should fit or accommodate your two fingers. The mid pelvis, you should not be able to touch the side wall simultaneously. And then for the ischial spines, the ischial spine should be blunt. Of course, the subpubic angle should fit your two fingers. And finally, when you fit your four knuckles, then you should be able to fit them properly without struggle. And that simply means that that pelvis is adequate. This is a skill that will help us to manage the mothers better when we are in labor ward. See you in the next video. Bye.